conditions, a relationship between PM 2.5 exposure in the first year of life and the development of autism with an odds ratio of about 1.3. So infectious diseases are also worsened with rising temperatures. In addition, societal disruption, where people are migrating into areas where animal species would be apart from humans, is happening with climate change disrupting society and habitat destruction. And here, I don't want you to feel like you have to read this slide, but just to give you an idea of how global this is, with blue being newly identified emerging infections and red being diseases that are identified in new areas of the world since 2023. And then, so we talked about extreme heat, wildfires, infectious diseases, air pollution. The other really big, encompassing, important thing here are mental health impacts: stress, anxiety, depression, what it's like to live through a natural disaster and have your home destroyed by a wildfire or a flood, or the anxiety of wondering what's going to happen to our world, what's going to happen to our children and grandchildren, the world they inherit. So there's a lot of stress that's caused by climate change. And that brings me to what can we do? I don't like to speak about all of these stresses and impacts without at least introducing a glimmer of hope. What Kathy Hayhoe and others say is that it's important to activate people and get them to see that we have a major issue on our hands. But if you don't give them the hope, people will be, they'll have the tendency to put their heads in the sand. So I always include hope in my talks. And, I love this quote by Teddy Roosevelt. What can we do? Do what you can with what you have, where you are, who you are. And I really encourage people to be advocates and communicators and to join together, because like with CCL, when we do things together, we don't feel like we're alone. We feel like we're working productively with people. I think it's really important for health people, health professionals like us, to know that we are trusted messengers, and I'll show you a slide on that in a moment. People listen to us. People trust their healthcare professionals. And I also believe it's important to communicate simple messages frequently. And Lori mentioned I am a braver angel. I really believe in engaging with others across partisan divides. That's what our Braver Angels mission is all about. And listening to people who may have a different viewpoint on something, like a solution to climate change. We're all aligned. We may all be aligned that climate change is happening and it's destructive. We may have different solutions for how it should be addressed. So the first is to join with concerned colleagues for action. And I wanted to say more about the niche here, and then at the end, we have a website that we collect articles, we collect talks, we have a quarterly meeting, we feature different people, and then we try to advocate within neurology and other groups. So I'm a member of that, and you can grab our website. I also wanted to mention there's a medical society consortium for climate and health. Even if you're not a neurologist, you can get involved. And I was recently appointed from the American Academy of Neurology to the European Academy of Neurology Environmental Task Force. So I'm very proud to be on that. It's a global, or it's a European group that's working on the environment and climate change. And then hospitals are some of the biggest emitters of greenhouse gases, fossil fuels. There's a lot that's being done globally to try to reduce that contribution to the carbon footprint. healthcare without harm. I mean, I can go on and on. These you can Google any of these. Obviously, I bold Citizens Climate Lobby because I really believe in our mission, and I love that we're bipartisan. But there are many other groups as well. This is the trusted messengers. I think this is super important. Primary care doctors are up there with uh, first responders, really. I mean, we're trusted messengers if you look at this list, and we've only had our trust increase over time. People believe us, people want to hear from us. Even if you're not a doctor, if you're a nurse or another healthcare professional, people trust you. And you don't have to be a primary care doctor. As a neurologist, we're oftentimes primary care doctors to our patients with MS or stroke or sleep disorders or whatever. I also wanted to put up that even among conservative Republicans, which can sometimes be the trickiest group to talk to about climate change, we're still up there, right? We're up there above Fox News and various other groups. So we have a lot to share with people, and we should feel like climate change is in our lane. It's definitely something that if we can just educate ourselves a little bit, like I tried to do today with the cycles and the different medical implications, we can do a lot. And when I talk to people, I don't necessarily get into polar bears and 1.5 Celsius, which a lot of people don't understand what that means. I talk about very simple things. So up in Vermont, I talk about snow and I talk about how sad it is that we don't have the same level of snow that we did in previous years, and how it's hurting a lot of our economies up here. And people, of course, want to get out in the snow and play. So find something that you care about and your neighbors care about and connect with them and tell your story and share a message. It could be about snow, it could be about anything else. I could be getting out into nature and feeling like when I'm connected with nature, I'm calmer and I'm less stressed. And I want to be able to continue to do that. Engage with others, especially those with different viewpoints. Stay hopeful, practice curiosity, build trust, listen to people. If they're skeptical about climate change, try to figure out why. I'm curious why you feel that way or how you came to feel that way, that the earth is not warming, or, and just listen to them. And then you can share with them what you know, and hopefully make an impact. And focusing on health is always great. It doesn't have to be climate change. It can be air pollution, like I mentioned. That's a big driver and culprit of health. Talk about your kids, talk about your community, talk about how devastating a flood is or a wildfire is. Talk about job creation, national security, market strategies like carbon fee and dividend or different border adjustment mechanisms. Be open to those innovative ideas. And potential energy is a great source if you want to look them up for Communicating Clearly, Saving Us by Katharine Hayhoe and other climate scientists who are focused on communication. And then I've done a lot of work in collaboration with Braver Angels where we've trained volunteers in communication skills. I'll end with my niche slide. I'm very, very honored to be working with these three amazing neurologists, Larry Junk, Brett Andrews, Ali Saad. We formed in 2023 after Larry and I wrote an editorial for the Neurology Journal in response to that scoping review I showed you earlier on how we could educate ourselves, get involved as neurologists. We presented a letter to the AAN board, and we met with the leadership of our American Academy of Neurology, which led to a session on climate change and brain health last year, and we're repeating it again this year. And then, of course, I'm honored to be giving a session at our meeting. We've presented multiple neurology grand rounds throughout the country and to other societies. Please grab our QR code and you can come to our quarterly meetings. They're free. You can hear speakers, pull our articles, and get involved. And on that, I'll end. Thank you very much for your attention. I appreciate it. Thank you.
Thank you.
So I would love any, I mean, I'm happy to answer questions. I'd also appreciate any feedback. I know it's a really hard time to be talking about climate change right now to non-climate change, non-climate people. I would welcome any feedback that you all have, given that you are climate change, climate advocates, right?
See here.
Okay, Dan.
So I'll get the ball rolling here. So what a great talk. I'm struck by the fact that you're bringing up neurological issues. So when we use particularly this connection between air pollution, because people can get it, that idea, and they have trouble with climate change. But the data I always see is from the ALA and others about cardiovascular disease and respiratory disease. So this is a whole new angle. So I think it's great to see that data, and in the work that we do, we will absolutely grab that. So thank you for that. A new world has opened up. The second question or thought I had was when you put up the slide about the ways to get involved in the different organizations. As we all know, there are a lot of people who want to get involved, but their heads kind of explode because they don't know what to do. And you pointed at the organizations, but another way to do it is from a different angle is to frame it as we can get involved in working at state policy, and we can get involved in federal policy, or we can get involved in hospitals, and there are probably others. And to kind of just pick one of those, like, right, so that we all try to pick where we can, where our interests lie and where we have time. And that could help people because they struggle, as we all know, narrowing down, well, where do I go? And then the other sub point of that is once you get into those groups, you'll find people who already have initiatives underway and you can join and help rather than trying to, become an expert in it and figure out, well, what's the number one thing to work on, is emphasizing the idea there are people already out there doing that, including all our state groups. And if you go join them, you're going to find people who already have a strategy in place and are looking for help. And that can overcome that hurdle of like, I don't know what to do.
I really like the way you frame that, Dan. Thank you. I'll definitely do that. I appreciate it.
Cynthia.
Okay, thank you. Oh, thanks very much, Beth. I think this is such an important topic. So many people are concerned about their brain. So a comment and a question. The first comment, we had a talk at the Medical Society Consortium, I think it was a year ago, and they said that the most salient fact that made people concerned was neurodevelopmental impacts. And so if you're, I think that's really interesting. You mentioned it, and I wonder if you might want to spend a little bit more time on that so that you let your audience know that they're the experts and they can talk about this if it's a neurology audience, but also a little more detail so that they feel comfortable about that. And then the question, I was also struck by the indoor and outdoor air pollution, and I'm not sure if I understood that slide because that went pretty quickly. So it was something like you get 3% increase in dementia risk for every 1 microgram of PM 2.5, but 17% of the air pollution is indoors and outdoors and 11% indoors. I think I've got that goofed up, but I know Brett is very, very active trying to get rid of indoor gas appliances. And so I'm wondering if you've made that connection between like your gas stove and asthma, your gas stove and dementia.
Yeah. It was with stroke, and it was 17% outdoor and 11% household. So yes, you got it right. And I think you're right. I can just take another moment and emphasize it's not just outdoor air pollution like the fires, right? It's also the way we burn fuel and all the yeah, I can definitely do the
Mhm.
household. Thank you.
And that's something that people can take action on immediately and start to connect to things like, oh, this is why we want to have induction stoves and another advantage of heat, the whole thing. It helps move people along that continuum of, practical things that you can do.
Yeah, that's a great point. Yes, and I appreciate your comment on the autism too. Actually, I specialize in sleep and autism, so that's one of the
Ah,
things near and dear to me. So thank you. I will include that.
Thanks, Beth. Along a line of one of Cynthia's comments, while don't want to go into a million studies, I mean, I guess when I started looking at the data, what impressed me is how many studies there were looking at, the risk to the brain from particulate matter. So, you throw out one or two, and you don't want to throw out 17, but I think saying that there are dozens of others, would be impactful to, people who are evidence-based, like the neurologists, I'm sure are. Um, and the other thing is, relating to Cynthia or whoever just said that the neurodevelopmental stuff is, one of the most concerning things to patients, or to, certainly when Rob and I give talks, most, more concerning to the audience audiences is, I mean, I think that a neurologist, most neurologists are internists, and as Rob says, internists are terrible at advocacy. I mean, they just, they're not used to doing advocacy like pediatricians,
Right,
like public health
right,
people do, but they do talk to patients. Now, most of the time when you say talk to your patients about climate change, people are saying, are you kidding me? I mean,
right.
even amongst climate and health advocates, they say that. But I think a neurologist educating their patients, people they're already seeing for neurologic diseases, that air pollution increases the risk of these things. I think that's a very powerful thing. They don't have to mention climate change. They can talk about either wildfires, or if they're treating under resourced peoples that likely live near in fence line communities or near interstates and those sorts of things, just letting them know that pollution increases the risk. um, and I mean, I think that could be hugely impactful, and it's something you can do in 5 seconds in your exam. It's not a huge conversation.
Exactly. That's great. Great feedback. Wow. Thank you. Robin.
Um, thanks for doing this. I really am glad you're going to speak to this audience. I actually have some expertise in this as a psychiatrist and overlap on brain stuff, and that's what I'm going to present to Robin and Lori's group in Montana. And some of the things that I would offer to you to add, and I'm going to build on Dan's comment. Everybody knows air pollution causes lung disease and asthma and all of that. I actually have a slide, and I have some slides that I would be happy to share with you, but that actually PM 2.5 and smaller particulate matter are directly have direct impacts through the olfactory apparatus. We breathe those particles directly into our brains, and that causes direct cellular damage in the brain. And there are other mechanisms. But I find that kind of shocking. We breathe this all the time, and you're not going to tell your patients not to breathe. It's not healthy. Um, but that might be something that you would want to add to, and I'm happy to share the slide that I have that shows that, as well as the cytokine storm through the pulmonary and vascular system that are some of the mechanisms.
Oh, I would love that, Robin. I'll put my email in the chat. So thank you. Yeah, that's a great visual to think about is, you're absolutely right. Okay, thank you.
Uh,
Oh, I think there's a request from Dan to send that data to all of us, so.
how should I do it to, uh,
Maybe to Lori, and Lori could send it out to
Lori, does that burden you?
No, no, I mean, we can't, send out the recording of this. You might have got on late until after she gives her talk at the national conference. Like I usually post it on the forum, so we'll wait to do that, but you can share
Send
your
it to me
slide.
in the meantime. I'll incorporate it. I appreciate that. Thank you so much, Robin. And yeah, I also saw your comment in the chat. That's an excellent point that the fires were fueled by the trees down from Helene. Yeah,
I'm just thinking those poor people, another insult. Oh,
yeah.
and I appreciate your mentioning the mental health impacts, Milo.
Yeah. Well, this is great. You guys gave me a lot of things to just kind of refine it, make it even stronger. Thank you.
I'm curious from those of us on this call, not all of us are in healthcare on the call, but we're all climate passionate and pretty well educated on climate issues. So was any of her data related to the brain new to anybody, if you're willing to admit that? Because when we give talks, yeah, I mean, that's the thing that people are most shocked about, and that is totally new to them. So
Mhm.
good. So several people said it was new. So
Can I ask a question?
please.
Oh, please.
I
Yeah.
don't, yeah, I don't know if Gwen had her hand up before I did or not, and now I don't see Gwen. Well, okay, do you want to go before me, Gwen? No? Okay, all right, I'll try to make this quick. I have two questions connected with conservatives and air pollution. I've noticed, well, it seems to me from stuff in conservative publications that I've read, I'm left of center, is that there is a concern among conservatives about air pollution, um, a serious concern. And even conservatives that think that climate change is either a hoax or overblown. And so I've thought about switching completely to just doing activism on climate change, because it seems to me that a really large chunk, and maybe the most of the chunk, that's my first question, is of climate change is related to air. If we got rid of all air pollution, how much of climate change would we have reversed or stopped? That's my first question. You
Yeah.
have to answer it, Beth.
Well, it's so linked, right? I mean, if you think about the fossil fuels that are also causing extreme heat, I mean, they're also giving off PM,
Toxins,
you
yeah.
have the particulate matter. So it's all intertwined. So I think of it as less we're going to impact air pollution. Let's focus on air pollution and not anything else. I mean, I guess methane, right, would be different, right? But I think of it as it's so intertwined. Just keep it simple and talk about air pollution, right? So if a conservative, for whatever reason, is skeptical about climate change, you can talk about air pollution and its impact on health and stroke and dementia, right? And autism. I also want to emphasize, I mean, I don't have really the time to do it here, that, I mean, we have a very strong conservative caucus in CCL. There are a lot of conservatives who are, I mean, there's Republic EN. There are a lot of conservatives that are supportive of climate change solutions. It's just sometimes the language we use, or as you know, Catherine, from our Bravery Angels action team meetings, like just talking about things like economic security and energy security and jobs, right? And clean energy. What are they saying now? Clean energy tax credits. So rather than talking about the IRA, talking about clean energy tax credits, right? So I was fortunate to be the co-liaison in Tennessee before I moved, for one of our conservative senators' lobbying teams. And the language we used and how we talked about. I mean, but it was very successful. I mean, we got a letter from their office thanking us for always being so professional and polite and feeling like, you know, there were several bills like the Growing Climate Solutions Act that they've got behind. And so I only say this to mean, you know, there's lots of different ways to think about it. It could be somebody who doesn't want to hear climate change, or it could be someone who wants to hear about other aspects of it.
Well, so I have a second question I want to ask connected with that. Do you know why it is that not all conservatives, but most conservatives, it seems like conservatives in general, are more moved, feel more comfortable doing so, are more concerned about air pollution than, for instance, about climate change? Is it because air pollution it's easier to make it be visible? I mean, why, if I'm right, that in general there's more concern about air pollution than climate change, why is that?
Well, I don't know. I think, you know, in some ways, climate change has been politicized more, right? By, I want to call them the conflict entrepreneurs, people who want to stir us up. And, you know, I don't know if that term is new to you, but it's the idea like if you read Merchants of Doubt, where you have
Mhm.
the whole tobacco industry and all. So, I mean, I think it's very hard to politicize our health. I mean, I guess it isn't hard to politicize our health with COVID, right? But it's harder to politicize our health than it is some movements like climate change that have been more politicized. So that makes
Right, and which they don't necessarily see as connected with health. They don't necessarily see climate change connected with health, and they would air pollution. I would think. Okay, thank you.
I also think heat cannot be ignored.
yes.
But most people think I'm just going to get through a heat wave. I'm just going to be fine. But heat is called the silent killer. And it's another place that I think we need to do a lot more education about.
Yes, I agree, Robin. I wish I had more time in my talk because there's a lot. I kind of skimmed the surface. But like even all these medicines that elderly people are on that I mentioned, your whole ability to thermoregulate is affected by your medicines. And then if you put somebody in extreme heat, and I don't think that the 1.5 global warming, which we passed now, I don't think that captures what a heat wave is or extreme heat. It's not that. It's not that it's a little bit warmer, because that's what I think people hear when they hear 1.5 or 2 degrees centigrade, is that, you know, it's more than that. It's the actual heat waves.
Okay. And this might be our last question, so we just have a few minutes to talk about a couple things that are probably worth.
Sure.
Sarah, thanks.
So anyway, I thought I'd speak up as a non-medical professional, right? I'm on the other side. I'm the environmental professional, sustainability, and look at it that way. But I find this whole conversation on health and the intersection to be a very powerful thing. And there's maybe 2 points I want to make is when you're talking about this, you know, particularly when you look at the home and the health in the home, I think that's a really powerful thing. And sometimes we forget that it's also a way of doing engagement with local governments. And I'll give you an example. I was doing some work, you know, just in my community where they had the county had some extra ARPA money, which was left over from the American Rescue. And what they were doing was going into houses, low income houses, where they had water leaks because they had water burdens. They couldn't pay their bills and they're sure turning off water. So the county went in there to fix the leaks and replace fixtures to make them more efficient. Well, when they did that, what did they find in those homes? They found out they had mold and mildew problems, which was a health issue. And so I had to remind them, why don't you bring in public health and Live Healthy Gwinnett that are trying to figure out ways to do health services while you're doing that at the same time. And they never even thought about it, right? That this idea of connection to health, because as they're working on improving and, water fixtures, they could also be doing things like fixing air leaks and weatherization projects all at the same time, which improve indoor air quality as they're working on their public health programs, and they could jointly fund it across multiple lines, but they didn't even think about it that way. So my suggestion is that if we can get even beyond just the medical professional, but reach out to bring in other people where they live and say, if you're going to be working and doing public health work, why aren't you reaching out to your water folks or your housing folks around energy efficiency? Because they're really one and the same in reducing either, VOCs, PM 2.5, or mold or mildew, and make it more of a interactive piece that people can see. And particularly for climate, I think, and that goes back to the other commenter, if you can see it and you can see what it's doing to you because people recognize mold and we can connect that to the climate story, now we have a place that we can meet, move, and go with. So anyway, I wanted to just put out that as a story. And then the last thing is, and Lori knows this, we're trying to do an effort where we work through trusted entities, which is through faith-based leaders. So we're going to be bringing medical clinicians together with, faith practitioners with a sustainability to really talk about people, planet, and health, and what's that connectivity, and to be able to put that out in a video log podcast format to start getting that conversation going. That shows that it isn't about one or the other. It's about all of us looking across these different things and understanding where we live. So anyway, I just wanted to maybe bring it up from a non-medical person, but I always find these things
Your
really interesting.
perspective. Thank you. Yeah.
Yeah.
Wow. Thank you.
Thanks, Jay. And maybe put in the chat the talk or the link to the to what you're doing this week with the Catholic.
Oh, okay. Yeah, absolutely. I can do it, Larry.
And then Cynthia, are you up for talking in a bipartisan fashion about issues you've already chatted about?
Sure.
Those of you that don't know, Cynthia is a retired rheumatologist. I think I have
Nephrologist.
nephrologist. Yeah, close. Smart people in California.
Okay. Well, I put something in the chat, which I am having trouble seeing now in just a minute. But a lot of people are very concerned about what's going on in our government that's attacking so many, the rule of law, the services that we pay for, the institutions. And really, I think that's not a partisan issue. This is our government, our services, and people are really worried and afraid about what's going on. Certainly, for us climate health people, the assault on the EPA, talking about rolling back regulations and stripping or really cutting the workforce, damaging NOAA and NASA, which I saw in your slides. How do we know all this about climate? Well, a lot of it's climate science and research, and that's being attacked. So all of these things are happening at once, and people are feeling like, what can we do? So there's going to be a mass mobilization, a rally that basically says hands off all of these things, hands off our Medicaid and our healthcare services, hands off our government organizations, hands out of the Treasury and Social Security and grabbing our private information. And none of that really is partisan. You wouldn't expect anybody to be doing that. So if you're interested, this is an important mobilization, and we're trying to get lots of people out. It is endorsed by the League of Women Voters and the League of Conservation Voters, which are nonpartisan organizations as well, 501c3, although different organizations will have different levels of comfort with this. So I'd encourage you to look at it. I put the links in the chat. It's called Hands Off 2025, Hands Off Our Stuff, Our Government, Our Democracy. And I hope you'll be able to look at it, attend, and share it with your organizations if you can, if not with all of your private contacts as well. Robin, would you like to comment on that? Okay. So how was that non-political enough, Lori?
Pretty good. Thanks.
Because it does not involve voting for anyone or any particular bill, so it should fit. These are, what do we want our government to do? Ideas.
And I do have a comment. We are in a very, very hard time, and in a very different time than we were just several months ago. And it is very hard to separate political points of view from the impacts on our health, our delivery systems, our basic science. And I think we have to face that reality.
Right. The idea that when you have a government that says an administration that says we want to hobble the EPA so that they cannot provide any new information that tells us how we're doing on climate. That shouldn't be political. That's just, are we going to be based in reality? And we're not going to be able to take care of our patients if we don't have this kind of information. Look at all the wonderful research that Dr. Mallow presented. And would that be able to happen when we're hobbling the NIH, silencing grants, silencing NOAA? I think we're in different territory.
Yeah.
Oh, so Jay, you don't have a job.
Well, it's, I went back as a rehired annuitant to help build the Office of Environmental Justice program. So I knew I was going to be early out the door. Here, I'll leave you with this. The really weird thing is, I'm the easiest guy to fire they've got, and they haven't fired me yet, and I don't know why. So I'm still trying to figure that out. So.
But you are on leave and not able to do your functions and the things that you ought to be able to contribute, right?
That's correct, because I was really trying to help with particularly the young folks coming on board, and I have a long history with EPA on public-private partnerships and building community capacity. So all the IRA grants that you saw for environmental justice, I designed all those with DOE and DOI before I retired the first time. So.
Well, thank you for doing that work, and I hope you'll be able to do it again.
I think it's a really hard time in so many ways because people do need. Oh, I'm sorry. Lance had his hand up, I think, and then I
Yeah,
can.
yeah. A
Please.
real quick question to Jay Bassett. Could you put your email in the chat? I would like to speak with you. I'm also in environmental science.
Sure.
I was just going to say from, the other work I do in addition to health, which is the civil discourse and the Brave Angels, is I do think there's a role for activism and bridge building. You might feel like your strengths are in one area more than the other, and that's fine. I think there's a role for us all to work together because when you bridge build, you actually spend a lot of time, like we teach, how do you listen to others' concerns, show them that they're being heard, and then how do you share your concerns, whether it's about air pollution or NOAA going away or whatever it is. And I think a lot of it is just making sure people get a chance to vent and you hear them, and then they'll hear you. So if anyone's interested in any of that, there's a couple of things. One is I'm writing a book now and on kind of how we can build relationships with each other in these crazy times. And I wrote a Substack, which is like a newsletter on activism and bridge building coming together. So I'll put my link in there and you can go to it and you could subscribe. It's free. And I would welcome any comments on kind of this intersection between bridge building and activism, because I'm a believer that it's important right now.
So Beth, on Dr. Larry McFloy is going to be on at the Catholic Action Team on Wednesday evening. He wrote Epidemic Leadership. You might want to read this book. actually talks
Epidemic
about that.
leadership. I will. I'll look at it. Thank you, Jay. It's not about COVID, right? It's
It's actually the idea of how, from an epidemiology standpoint, how you can spread systematic change, just like disease takes place in the natural environment. And how do you do that through social and social capital
yeah,
systems?
I
So
like
yeah,
it. Thank you so much for that. What a great,
Jay, are you
great
implying
meeting.
that we're spreading disease?
No, I think it's more about,
Don't take me seriously.
I know, I know.
I just looked it up. I'll put it in the chat. It looks really good.
Well, just seeing all of you gives me faith and hope, as it always does, seeing and talking with other people passionate about climate. And I think we can hope that our conversations across the aisle actually are more productive these days because people are concerned. And I think that there are a lot of people that think differently than a lot of us that are still concerned about climate and are concerned about what's happening with the attempts at erasure of climate on federal websites. So maybe we should practice our best we can of our braver angel trainings and try to talk to people about this. And yeah, I would love it. Put it on the forum if any of you are doing anything within your states that sort of relates to the critical time that we're in right now, whether it's as your health team or as your CCL group or any other climate action group that you're in. If you're doing things that you think might be replicable in other states and other areas, please let us know. I think we're all searching for that right now. Beth, you're going to be a rock star next month.
Thank you. Well, thanks to you all. You gave me some great
Yeah.
pointers. I
I'm
appreciate
sure
it.
I'm sure it'll be a great talk. I thank you for doing this and for doing it next month. I think.
Yeah, and thank you for all your great ideas and check out my Substack. And we just got a Braver Angel. Well, it's Braver Angels Oid. It's a little op-ed that I wrote with Bruce Moreland, who was here last month. So I'll post that on the Action Team page, Lori.
You don't have it to put in the chat right now?
No, I
No
do.
pressure. Oh,
Yeah, I know the meeting, we're just about at time,
I know. I'm holding.
but let me see if I can find it real quick. It just came out on in the Green Energy Times, which is, hold on, I think I have it here. Yep, here it is. And I wrote it with Bruce Moreland, who co-founded our team. So check that out as well. It's kind of like we're going to save democracy and cure climate change at the same time, right? Why not?
Right. Thanks.
That's our motto is actually we need a healthy democracy to solve climate change. That's part of it. To make
Yes,
sure that our voices can be heard and our votes counted.
yes, absolutely.
Well, thank you all very, very much for the amazing work that
Thank you so
everybody
much.
is doing
Yeah.
and for the caring. And we will meet again in a month, but please feel free to put these kind of issues in the forum. We welcome forum posts. And I know sometimes those of us that post feel like nobody reads them, but actually everybody gets them in their email. So I think a fair number of us actually do read them, even if we don't, we're not social media sorts of people that we click on likes and that kind of thing. But I think we get the word out. So thank you very much.
Okay.
All
Thanks
right.
for making this happen, Lori. Okay.
Thanks so
Thank
much.
you.
Yeah.
See you all.
Lori, thank you so much. This is so awesome to have the chance to get feedback from this group. Appreciate it. Appreciate you all.
Thank you. Okay. See you next month.
Bye-bye.
Sooner on the forum.